Raul Nogueira. I'm an interventional neurologist at Emory University and Grady Memorial Hospital in Atlanta, US. I think the first impression is just this great feeling of being able to see your colleagues again and interact with different people from different cultures, exchange experiences. I think the last couple of years have been very challenging with the pandemic. When you had the first iCure was just at the very beginning of the pandemic. You were very lucky because it hadn't reached yet Turkey when you last did it, and then you were separated now for almost 2 years. So it's just this great feeling of being back here, seeing the colleagues again, exchange knowledge, teaching, learning, and specifically with some of these live cases, it's such a great opportunity for all of us. I think what we really want the most for these meetings is to try to educate specifically communities that have historically had less access to this type of event. And I just love the team of iCure, which is this bridging therapies and communities, right? So the idea here is, even though it's more focused on endovascular treatment of stroke, you are also you're always balancing that out with all the medical therapies, intravenous thrombolysis, all the other options. And then bridging communities, you have colleagues from Europe, Asia, even Latin America, and the opportunity to interact with them, to learn more about their reality, and hopefully help changing that reality by trying to improve the level of understanding, education, and see the growth in the field. I just had a great conversation with a colleague from Pakistan, and he was saying that when he first came here just about 2 years ago, he was just starting his stroke center, and he now gave us a follow-up that he's doing over 100 cases a year, and things have grown a lot, and he really enjoys this education experience. So I think this is very rewarding, it's very fulfilling for the people who like to teach and who enjoy a scientific and academic environment. I think from a technical standpoint, the transmission of the live cases was great. I think the satellite transmission was flawless. We had some issues with in talking to the physicians and getting some of the details. Here things are a little more challenging. There are very few people that have dared to do live cases with acute stroke because there is very little opportunity to plan. So I think it's very unique to see what you are seeing here. You have to have a little bit of luck because even though this is a very big and busy stroke center, the cases have to come at the right time. For instance, last night I was at the hospital with Sardar and the group, and they did 2 thrombectomies back to back. I think this was around 11 p.m. We came back home. They had another thrombectomy in the middle of the night, I think 4 or 5 in the morning. But nothing happened during the day, so you couldn't really have any cases. So today you were lucky that you had not only a case, but a case that had a lot of educational opportunities, because you don't want the straightforward, easy case that you just go, you pull the clot and you are done. Those are not the cases that really educate people. You want to show the more challenging cases, and today you were lucky to have a very hard transfemoral access. You had discussion about the options, including radial access. The team decided to go with a carotid access, so you had the opportunity to discuss the best techniques for that. And then after that, there were many challenges in terms of tortuosity, not only at the arch with the more basic access, but also intracranial access. And was just a wonderful opportunity to discuss the different types of techniques and rescue maneuvers. Oh, absolutely. Come back next year. You are committed to make this better and better. Overall, the philosophy has always to keep things in the open, to allow for these live cases come whenever they want. The focus here, it's not necessarily to follow a program, but rather to educate. And if the group is engaged, you're just going to keep with the discussions. And I think it's a very flexible forum, but you are still learning on how to make this better. I think every year you do it, you learn more in terms of what is the best approach to improve the educational experience. So stay tuned and join us next year.